Ravinder Gupta ji. He was the one who began this campaign, and today we are very fortunate to have with us one of the eminent personalities in the field of public health dentistry, Dr. Swati Sharma, who happens to be a colleague of Dr. Sahil. Very warm welcome to you, Dr. Swati, on behalf of the entire SDC team and, of course, personally also. And I think the topic which you are going to take up today is probably very apt for this occasion. In my personal opinion, tobacco, even though we people have been putting our best efforts to curb this menace, but probably this still continues to be one of the what I'll call as the greatest preventable threat to the public life, right? And we as dentists, as oral healthcare professionals, I think we are in a very, very good position to guide the general public regarding the ill effects of the tobacco habits. And we definitely can contribute towards the public health by at least, if not contributing to the tertiary care, at least at the primary care level, if we can diagnose the lesions that are the end result of the tobacco habits. So not taking much of your time, once again, warm welcome, Dr. Swati Sharma, and we are really truly grateful to you for being on this particular platform. My best wishes to you and the entire team of Department of Public Health Dentistry led by Dr. Sahil. Thank you so much, Dr. Sahil, and your team.
Thank you, sir. Sir and ma'am, with your kind permission, I've taken the liberty to start recording the entire session, sir. So I hope your consent has been given for the same, sir.
Yeah, surely. Please go ahead. Okay. I'll be listening to her.
Before we start, I'd like to congratulate you and acknowledge you that, sir, you are being a really good, an exceptional team leader for understanding and providing the department with the new mobile dental van. So before I start, sir, understanding the importance and that too in a UG department is really commendable, sir. And thank you so much for giving me this opportunity to connect with your students, sir. It's a privilege.
Most welcome always.
And I would like to thank the directors also before I start, Dr. Vikas Jindal sir and Dr. Amit sir, and for calling me over here. That's what I was asking Dr. Sahil, that yes, Himachal also we see so much of data, and but yes, it's not that somehow, yes, I'll be able to connect with the students. I have been in touch with your students, sir, in few conferences they have come. Dr. Sahil had sent us in our university. So they're very different, yeah. So I hope that I could connect with them and I could, add some value to their knowledge, existing knowledge. Yeah. So thank you so much, sir.
Welcome.
All right. Can we start the session with your permission, sir and ma'am?
Please go ahead, dear Dr. Sahil. Please carry on.
Right. Dr. Kushi, if you could just start, please.
Thank you, sir. A very good evening, everyone. It gives me immense pleasure to warmly welcome all the participants joining us today for this insightful session under the World No Tobacco Month 2026 webinar series, organized by Himachal Dental College, Sundarnagar. I would like to extend a heartfelt welcome to our directors, Dr. Anil Singla sir and Dr. Vikas Jindal sir, Principal Dr. Baljit Singh sir, our esteemed speaker, faculty members, and to everyone who has taken out their valuable time to be a part of this important initiative focused on awareness, education, and creating a healthier tobacco-free future. I'm Kushi Sharma, BDS Intern at Himachal Dental College, and I feel truly honored to be your moderator for today's session. At Himachal Dental College, we continuously strive to promote academic excellence, public health awareness, and meaningful learning opportunities for future healthcare professionals. Today's webinar reflects our commitment towards empowering students through evidence-based knowledge and expert insights. So today, we are truly privileged to have with us an accomplished academician, researcher, mentor, innovator, and leader in the field of public health dentistry, Dr. Swati Sharma ma'am. Dr. Swati Sharma ma'am is currently serving as the professor and head of Department of Public Health Dentistry at School of Dental Sciences, Sharda University, Greater Noida, and brings with her more than 17 years of extensive experience in academics, clinical practice, research, administration, and public health. She completed her BDS from Vinayaka Missions Dental College and pursued MDS in Public Health Dentistry from Pacific Dental College, Udaipur. In addition, she holds an MBA in Hospital Management, showcasing her multidisciplinary expertise in healthcare leadership. Dr. Sharma has made remarkable contributions for research and innovation with over 1,400 citations and an H index of 15, numerous publications in reputed journals, and several authored and edited academic books. Her dedication to innovation is further reflected through multiple granted and published patents in the field of dentistry and healthcare technology. She has also received several awards and recognition for her outstanding contribution and excellence in oral healthcare, research, education, and innovation. Ma'am has actively served as a keynote speaker, mentor, scientific committee member, and educator at various national and international conferences, webinars, and public health initiatives. Her work in tobacco cessation, oral health promotion, communication skills, and community dentistry continues to inspire students and professionals alike. Beyond her academic achievements, she is admired for her dedication towards mentoring students and advancing community healthcare through evidence-based approaches. On behalf of Himachal Dental College management, principal, all faculty members, organizing committee members, and participants, I extend our heartfelt gratitude and a very warm welcome to you. We are honored to have you with us and eagerly look forward to learning from your valuable experience and expertise. Before we begin, I would like to inform all the participants that if you have any questions during the session, please feel free to type them in the chat box. I will read out these questions for ma'am and she will address them at the end of presentation. Without further delay, I would now like to invite Dr. Swati Sharma ma'am to kindly begin today's session. Ma'am, the virtual stage is all yours. Thank you.
And I think I would like to add, if anybody has any questions, definitely they can raise their hands also. In the end of the session, we'll unmute you and you can ask questions from ma'am. It is a wonderful opportunity for our students to learn. So I think over to you, ma'am.
Thank you so much. And I'd like to personally thank Kushi, who have been in touch with me. So thank you so much, Kushi. And I would be sharing my screen. I would be needing your assistance a little more.
Welcome.
So I hope the screen is visible. Yeah.
Yes, now is visible, ma'am.
Yes,
Yes,
Kushi,
ma'am, it is
it
visible. Yes, ma'am.
Okay, and I'm audible. Yeah. Okay. And we have mostly undergraduates, right? We have interns or final years or a mixed crowd?
Yes.
We have a mix,
Yes,
right?
ma'am.
Mostly focusing on interns and final years, ma'am. And any question and whatever you'll teach us there, that will be asked in the Viva, and they need to, as students of HDC, they need to know a lot of things. So
Okay.
I have told them to listen attentively, and it can come in the Viva because they might not realize today, but tobacco is such a big topic that tomorrow in the coming interviews or wherever they are, I must tell my students that since we are starting here with ma'am, it is better to learn from ma'am. Tomorrow you might be given an interview, ma'am might be the expert there in public health. So you can learn a lot from ma'am and you can tell her that, yes, ma'am, we were part of your lecture. So now it's over to you, ma'am.
So yes. So before I start, my dear students, a very good evening to one and all. And I would like to tell you that, why this webinar, as Principal Sir had already mentioned, that we all are celebrating World No Tobacco Day, which falls every year on 31st May. So you are privileged that, you have a very robust public health dentistry team, and this webinar is being arranged. So the first topic, as the topic itself indicates, the dentist role in tobacco control. So why dentist? It can be any other healthcare professional. This question may come to any undergraduate student that, okay, we are pursuing dentistry, but why? What is that peculiar? What is that, very insightful that a dentist has a very massive role in tobacco control? Yes, I would like to state over here is dentists are the ones among all the healthcare professionals. Tobacco has an immense effect on our entire human body, but the first effect and the one of those effects which can open up our eyes as a healthcare professionals is none other than our oral cavity. That's why over here the dentist role comes into account. And we as a community dentist, we as a public health dentist, we have our role and our domains, not in just in the field practice, but in our clinics, in your OPDs. When we go to the camps, when we go to any community settings, we are being exposed to so many patients altogether that no signs of the harmful effects of tobacco we could miss. That's why here the topic comes that the dentist role in tobacco control, and itself it indicates from clinic to community, right? So first of all, why tobacco control matters. Before I fall into the data and the specific things about tobacco, I would like to say and share a few experiences also, that we have seen tobacco use as a community dentist in all populations, whether it is urban or peri-urban or rural. And almost all are right now, we can say that our country from a developing to a developed, it is in the verge of going to a developed nation. So in this progression, we could see that there are lot of the groups which are now aware that yes, tobacco is injurious, but how many of them are actually aware that it can be so addictive in the end, and how many of them are aware that it can lead to none other than our precancerous lesions? So we as a dentist have a very an important and a massive role in helping them to detect that yes, tobacco is something which is a very serious, a very serious substance which has to be taken into account apart from leaving its addiction. So we have to help the communities. So if we come on to this, if we see the data of that why tobacco, because tobacco use is it's not just a habit anymore. It has gone beyond that. It has it has affected nations together, masses together. If we see the data, so tobacco, it causes over 8 million deaths every year globally. And mind it, this all data has been taken for few of the surveys, but the main data with the main database which gives us the information about tobacco use is, you can all Google it, you can all use it. It's Gates survey. It is done every 10 years. So now we are expecting it anytime, and that is by the name of Global Adult Tobacco Survey. So GATS survey has provided us the data globally that tobacco, it causes over 8 million deaths every year. That is every 4 seconds, one death that is due to tobacco. So by this data only you could relate that why it is important to us. And it is the one of the most important and the leading cause of oral cancer. And now why oral cancer? Not because just we are dentists, because before that, because if we see the oral cancer prevalence and the incidence, so globally our country comes third in the in the cases of the new cases of the oral cancer. So something which is leading to oral cancer is tobacco. So this states that tobacco is one of the, India is one of the highest users. It has one of the highest users. And this I'm not saying just in Middle East or Southeast. Globally, it is one of those top users of tobacco. So, and yes, tobacco use doesn't just leads to oral cancer. It affects the entire systemic health. It starts from the oral cavity, then it's the main effect is in the lungs, then our GI system, our entire respiratory. So by this, it is no more a habit. Yes, it is a habit because it is difficult to leave, but it is crossing. It is affecting so many people altogether that it is a public health epidemic. Yeah. I already shared a gist about it, that why dentists are the key players. Dentists are the key players because we are the first to look at the oral cavity of any individuals, right? This is the main, I'll say the main USP, which can be really important for us when we are dealing with the control of tobacco. Yes, dental professionals are unlike any healthcare professionals. The patients, they come to us for any dental treatment quite number of times. So we will have a lot of visits. So the first main role of a dentist is not just key identification, not just screening. Yes, that is the main role. But then apart from that, we can't leave it then and there. So dental professionals are bound to be in touch with the patients for all many visits. So we as a dentist have that advantage that we can be in touch with the patient for all our appointments, for all our consultations. So it's not that once the patient has come, we have given the consultation and the patient goes back. No, the patient is coming again and again. So why can't we be the torch bearers, in helping the people to quit? Yes. And so thus we have a lot of, if you see the third point, we as a dental professionals, we have an opportunity for repeated counseling. It is unlike any other healthcare professionals. If I see, I am not deteriorating the other healthcare professionals, but I'll say that we have a lot of responsibility on our shoulders, that we are very lucky that we could be of a great benchmark in controlling this epidemic. The most important thing, screening. When a patient comes to us, all of you, in fact, including me, we are, posted in different departments. We are dealing with different kind of cases, whether it is any diagnosis. But when we are doing the clinical diagnosis and we are screening the patients, so the first few signs of precancerous lesions, which the main cause of precancerous lesions are none other but the tobacco use. So we can again be the torch bearers to identify those precancerous signs. Thus, screening, which is just being led by undergraduates, that it is nothing but a case history examination. No, it is much, much beyond that case history examination. It is your sensitization to screen those at-risk patients who can be the oral cancer patients at the last. So this is how the training starts. So you have to be very, you cannot afford to leave all those screening parameters. Yes. Now coming on to the types of tobacco use, then why India? Why Southeast Asia? Why it is so that why this part of the continent is being exposed to so many types of tobacco? Yes, because we in our country, maybe because of geographical preference, because of regional differences, because of religious differences, I'll not say differences, rather inclusions, but then there are different types of tobaccos which are being used in our nation. So broadly, if we see, the tobacco is of two types. I'm sure all of you are aware, but still to reinforce it again, it's of broadly two types. We have a smoking form and we have a smokeless form. Now later in the slides, I'll go through that. There are a lot of myths, which are being attached with the tobacco use. When you go to the campsite in the community setting, or maybe some of you are already being exposed, the patients, they usually come and they tell us that smoking is not injurious, or smoking is injurious. Tobacco chewing is not injurious. Gutka to theek hai, we can have it. So this is a very common myth which at least I have encountered in my region, and I hope that would be the same. So there are broadly two types, and smoking is something which everyone knows. Smoking is injurious. Maybe it is being written, or maybe they want to avoid. They don't want to accept it that chewing tobacco is much more injurious to the oral cavity than smoking. So in the chewing form, we have cigarettes, we have bidi, we have hookah, we have vodka, we have canny, and in different parts, like the main prevalence of tobacco, if we see in our country, it is in the eastern states and the central states. So according to NICPU, which is National Institute of Cancer Prevention and Oncology, the data which is being released, they shows that eastern part of the country, northeast states are highly, because, and it's not because it is being grown over here there, because it's a very common regional practice. I was a part of that research as well in NICPU when I worked there for some time. So it's like that. And gutka and canny and zarda, they are typically being used in the central part of our country. So from here only you could make out from the vast variety, I must say, of the tobacco which is there in our country, which is unlikely in any other continent in the world. I'll not say in India. India, though we have so many, but in globally also you will not find so many types of chewing form of tobacco. So so many types of availability of chewing form of tobacco itself indicates that how deep the problem is of tobacco control in our country. And we as a dentist can be a real torch bearers, starting from not leaving any patient, and starting from, in fact, I'll add it up to this point, that starting up not to leave any patient unnoticed with any early signs of oral cancer, because it is not but the main cause is nothing but the tobacco use. Okay. Now, if we see the statistics, which is there in our country, I'll be coming on to Himachal Pradesh as well. So I shared about Gates survey. So Gates is nothing but a global adult tobacco survey, and we are waiting it for its another the report. Maybe I think by the end of this year it should come. There is another another baseline data site which is available and which tells us about the oral cancer cases. That is Globocan. So for an undergraduate student, again, it is important. There is one Gates survey which tells us about the tobacco use, and there is one Globocan which tells us about the oral cancer cases. So if you just see the slide, the Gates survey, it tells us that in 15 plus in adults, see the percentage of the people who are being used it's alarmingly high, and out of this 28.6%, the majority are using smokeless. Why? Because it's easily available. And if we see the oral cancer burden, so every year 77,000 deaths are happening because of this oral cancer. Oral cancer is actually, unlike any other cancer, oral cancer, the cancer of the oral cavity is not taken only that it is something until and unless a person's oral cavity just stops opening and the quality of life just deteriorate. So till the time when you will see a case, all of you might have seen, I'm 100% sure you would have seen so many cases of precancerous lesions. But even if a patient is having a precancerous lesion, they are okay to use a tobacco unless and until their quality of life deteriorate to such an extent they are not just able to open up the mouth. And again, one more important thing is, it's not just only those who are using the tobacco are being affected, and they are the ones who are being affected, and oral cancer would develop in that. Yes, those who are using, they will definitely are affected. But the another hidden part in tobacco use is passive smoking, passive use. So anyone who is using a tobacco, the adjacent ones, we all are being affected, whether we use it or we don't use it. If we see your stage, so over here, just see the third point, youth tobacco. In your state, the amount of tobacco which is being used in youth. So youth is nothing but 17, 18 till 24, or after teenage. So that age, the amount of tobacco which is being used is quite high as compared to other states. So I don't know whether, it is, I'll not say that it is due to there is no awareness. If we see the literacy rate of your state, it's quite good. So I'll not say that people are not aware, but maybe the people are not, they're not bothered, or they're taking it lightly. And this kind of a pattern is observed in other states as well. But the tobacco use in youth is a little alarmingly high in your state. So again, your role, my dear students who all are there and who all are not there also, you can share the message that you could be of a real, torch bearers and help the community in not to use the tobacco. A very important thing, myths versus facts, which we all encounter in our practice, whether it's individual settings or in a community settings. We all are being faced that yes, one of the very common myth is smokeless tobacco is safer. That's why so much of use is there. But my dear students, I think the general public, they're not aware that this is the one which is most injurious, and especially for any precancerous lesions to happen. Occasional smoking is harmless. Okay, this is again very, when we take the case history, when we examine a precancerous lesion and we ask them, so initially they'll not open up, the patients, then they will say, yes, I do smoking and I do it occasionally. So they take it very lightly. So I mean, we as a dentist should not, we have to be very particular in listening to what the patient is saying. But again, we have to intervene it somewhere. We have to tell them the importance that how much, in fact, I would suggest you, we all should tell them from the fact that how much is a cost of one pan masala. If suppose a patient comes to us and say that I use pan masala, I use this, and it hardly comes for this. So we as a dental professionals also, we should give them the amount of, the income of that person who is being spent on just buying pan masala for those 30 days and the expenditure on his health. So, and on what he could have done with that money for his family. So small examples, my dear students, we should tell them. Then see the second last point. Secondhand smoke is not harmful. This, most of the general public are not aware. Then e-cigarettes, vaping, this is for you, the students. E-cigarettes and vaping is a very, it's a very accepted norm. But my dear student, it's all a marketing strategy. Everything is very injurious. And we as a dental professionals, again, I'm reiterating, we could be of a real torch bearers. Coming on to the main clinical part, what are the oral manifestations of tobacco? We have been talking about that we as a dentist are the torch bearers. So how torch bearers? Our work starts from when the patient comes to us, sit on the dental chair, and we are examining, taking the history, whether the patient tells us a lie or whether the patient is telling us the truth. The moment we open the oral cavity, we will see. What do we see? What can we expect? Tobacco stains, they're very typical, Tobacco stains, precancerous lesions, which can be scrapable, which can be non-scrapable. So leukoplakia, smoker's palate, lichen planus, OSMF. Out of all, there are few lesions which really affect the quality of life. Oral submucous fibrosis is something for which the patient will come to us. But something like a leukoplakia. Leukoplakia, there is no burning sensation. There is just a white patch. Patient may not even come to you. In fact, even on the routine examination, when you will tell the patient that you have a precancerous lesions, they may not believe you. They may say that, okay, doctor, I am having a precancerous, but I'm not having any problem. I'm not having any burning sensation. So your job becomes a little more challenging over here. You need to tell, you need to explain the patient that the nicotine, that all the carcinogenic products which are there in your tobacco, initially you're not having. Initially you're feeling very, you're feeling happy, you're feeling lively that when you take a tobacco, but then slowly and slowly all these carcinogens gonna go in your oral cavity, it will leach, and slowly there would be changing in the mucosa, and that is where the white lesions, they would come into account. So you need to explain the patients. Lichen planus, yes, the patient may come to you that I am having a problem But again, the tobacco stains, some may come to you, some may not. So few of the lesions will direct the patients to you, few of the lesions will not. So they are the ones which are the most dangerous lesions, on for which you have to be really very careful while you're doing the screening. Now, so because you might be thinking that ma'am is being telling that tobacco, it is not a habit, it is an epidemic. Then what are the organizations they are doing? Yes, the organization are not sitting quiet. The very, this particular day of anti-tobacco day is being celebrated worldwide. It itself indicates that the kind of importance which WHO has given. But because of so many legislations, so many stakeholders, now you might be thinking, it's a very common question which is being asked to all of us as a public health dentist. I'm sure Dr. Sahil would have also faced this question from any of his or her student. That why when everyone is knowing, aware, the government authorities, the doctors, all the stakeholders are aware that tobacco is so much injurious. It's so hazardous, not just injurious. Then why it is there in the market? It's a very common question. So I would like to tell you over here is that it's not our government is not doing anything, but it is a tax free, right? There's so many companies and so many workers who are being involved with the companies which deal with production of this. So slowly and slowly, I would say the availability is being, that the government is basically trying that the availability is reduced, but they can't do it just drastically, because all these stakeholders, so many people are being involved. Now, one of the most important strategy which has been laid down by WHO is empower. So monitor, protect, offer help, warn, enforce, and raise taxes, right? So it's not that the government is sitting quiet. Government and WHO has done. And these are 6 proven tobacco control interventions, which is being laid not just in India, but worldwide. So monitor, we have to see. Now, every nation, every continent rather, I'll say, have their own, the M component. They have to monitor how much tobacco is being used, and accordingly, they have to make the policies. Then they have to protect the people from the tobacco smoke. So how they will do? Maybe the cost, they will make it high. I'll be telling you about the Kotpa in after a few slides. So a lot of legislation has been laid down by our country per se, in terms of that the selling of the tobacco products is not allowed in the public areas, typically around the colleges, around the university. Then so such initiatives are being regularly taken, and they are being strengthened also. Then the most important component I'll say over here for me as a public health dentist is W, that is warn. We, out of all, everyone, there's so many stakeholders who are being involved in this empower strategy. But if I see all out of all these 6 points, then warn is the most important thing. So we as a dentist can really warn the general public, our fellow colleagues, even when even the fellow colleagues, our own dental healthcare professionals, they also use tobacco. So you have to warn them time and again that what are the dangers, what are the ill effects, what are the carcinogens, at what cost we are taking this. So what else we can do? The chairside brief intervention. So we have a 5 A's. I'm sure in your undergraduate lectures, Dr. Sahil would have informed you about this, the 5 A's and the 5 R's. Just to reinforce a little bit. So the 5 A's are ask, advise, assess, assist, arrange. Right. So first of all, we as a dental professionals are communicating with the patients, we are identifying the signs in the oral cavity. So our role starts here, and those 5 A's should strike in your mind. So you have to identify what are the factors, what are the behaviors which are affecting the oral health. Is it just the tobacco or any other thing? Then when you're asking, apart from knowing about which is the product, and you have to go into the depth, and you have to ask the patients that what led those patients use tobacco. What is there? any change in the behavior, or they are using it for the style. Like in the youth population, it's very common, just as a style they are using it. So, or in the middle aged, or in someone who's from a slum, or someone who is like a truck driver or a brick worker. So there the so everyone. So imagine there is a person who is from an urban locale. There is a person who is from a rural area, someone like a brick worker, a school child, or a college student. All of us may use, but their reason would be different. So in this ask, you have to point out for that. Then advise. Advise, mind it, my dear students. Advice should not be, it should not that, you're just telling. You have to give the evidence that why are you telling and how our advice is different, how it can be. So you have to go into the depth. For this, for advice, you have to ask. So once you know the reason, then you can advise. So advice is something which is tailor-made, which is customized. So then the patient will listen to you. Assess. Then over here, the most important thing is assess. So either a patient would be willing to quit, or a patient would be like, I'm okay. So here the strategy differs. If a patient is willing to quit, then the tobacco control strategy is something different. If a patient is not willing to quit, then it is different. So if a patient is willing to quit, you can start with initially with the counselings, and then if it is needed, NRT. But if the patient is not willing to quit, then it is a different thing. Then you have to tailor-made their counseling plans. You have to call them in a way that they attend the counseling, and you have to involve maybe their family members, their close ones. So it goes like that. And then comes the assisting and the arrange. Assist is, if a patient is ready, then yes, assisting component would be comparatively easy. Easy but very challenging because the patient is ready. But the addiction component of tobacco use is so much that it is very challenging. So you have to tell the patient that you have to, support the patient. And then arrange. You have to arrange in terms of all the follow-ups. You have to be available for the patient at all the counselings, because out of a lot of difficulty, the patient has decided to, leave it. So if you are not there, then again the same cycle, it reverts back. From clinic to community, I think I've spoken about this, but again, why clinic to community? Because in any kind of community initiatives, we are being exposed to masses together, lots of people together. So at one addressal also. So not just about the screening, but when we are at the camp settings. So by just being at one camp, so what is a one camp is hundreds of patients, right? So this is where the difference comes. So just it can be numbered as one camp, but that one camp is not just one individual. It is as many as possible, right? So if your addressal at the campsite is so effective, it is so evidence-based, you could, we as, as a team, yes, the students, you can be really a torch bearers to help them know that what are the drawbacks, how tobacco can deteriorate the life of any individuals. So those initiatives can be in a simple dental camps. It can be school awareness programs. Mind it, in all kind of school oral health programs, inculcate in any school awareness program, should be a part of any school oral health program. Always inculcate some pointers on tobacco use to the school population. Then the rural outreach initiatives. You have to tell in such angles that the cost of living is only so difficult. So start from here, that how tobacco use is deteriorating. Then in all community screening programs, inculcate the message about tobacco use. If you don't have the time, you have so many patients, sometimes it happens at the camp settings, then put on certain hoardings, put on certain messages, so that whenever a patient is coming to you, masses, so many people are there, they'll at least read it. So when they're reading it, you might not tell them, but when they're reading it, they're being exposed. So this is a kind of a passive marketing. Yes. So we have already spoken a lot. about what is the role of the dentist, the dental students. So dental students, typically, as compared to other healthcare professionals, the first main role, the most important, is the screening. Then comes the awareness. So again, in the second point, I like to add up over here is awareness is not just when the word awareness comes, don't think about community initiatives. Any department you are going, whether you are going to oral surgery, perio, pedo, if you encounter any patient or their close ones who are coming with the patients who use tobacco, give them the awareness and give them the importance of the, and that awareness message should be given with utmost importance. It should not be that it should be a very casual approach. If you are taking it as a casual, then the community will also take it as a casual. And yes, see the fifth point. We have spoken till fourth. See the fifth point, documentation. When you are actually conducting tobacco cessation counseling in your clinics, you need to document that from where did it start, how much was the addiction, how many we have a progesterone nicotine dependence, entire proforma, which was being given by DCI. So those who are being posted in tobacco cessation, maybe you are being exposed to all this. So those who are not, for their information, so we have, such forms which are there on the DCI. In fact, you can make an app also, because it is handy nowadays, and make an app documented that which was the patient, who was the person who are using this, what was the reason, are he interested to quit or not? If they are interested, what have they done? How can you do it? What you have started? Have you started with the counseling? Have you started with group one-to-one? How many sessions? After how many sessions the patients have decided that yes, they will quit it? Once they have decided, was it the counseling sessions enough, or you have to start with NRT? If we have to start with NRT, so then what is the dose, right? And whether the dose was same, or you have to give in the NRT, whether you have to give the tablets, you have to give the patch. So like this it goes. And then if it is needed, then referral. In the terms of, if sometimes the condition of the patient is so bad that he or she is not in the sense to think about, because they would have started use tobacco due to some reason. So then you have to refer those patients to de-addiction center. So this also you have to do it. Now, one of the very common approach. Usually in the initial years, I have spoken about this just on a fast redo. You have to be, we as a healthcare professional, see on the right side. We have to be very warm and respectful. Whatever the patient is telling us, we have to be active listeners. Our role as evidence, providing the evidence and speaking comes the later part. We have to be very active listeners. We have to, and we have to be at their dispersal, in the sense that those people who are tobacco users, they are addictors, they're already addicted. So it's very challenging for them, that if we tell them that you stop using, they will say, but it is very challenging. We have to accept that, and we have to take small steps, right? And we have to be ready that we have to give them the support. So even if out of 10 patients, you are able to make one patient tobacco free, so that is a commendable job. And the kind of satisfaction which you as a healthcare professional will get will be much more than just treating a patient. Because imagine, when we are dealing with tobacco addiction, you are dealing with the behavioral control of someone. So this is something more than just the treatment. In just the treatment, the patient is coming because he or she might be in pain or whatever. I'm not going into that part because that is not the domain of today's webinar. But in the treatment part, the role finishes over there. But in something like as a tobacco control, it is beyond the sessions. It is something which we are we are handling with the behavioral modification. So it's very challenging. Yes, we can use the media, which is a very common, not a common tool. It's a very, I'll not say it's a new tool, but I must say it's a very effective tool. So all my dear students every one of us are there on Insta, on Facebook, use those platforms even for healthcare also, even for awareness also. And minded, the number of the users which you can use via media for the tobacco awareness would be enormous. So use these platforms even for your own, I'll not say benefit, but on your own ethics also. We all have responsibilities, right? And see, the third point, you can create videos, before when the patient comes to you, and the first appointment, you can just create a reel, ask the patient, take the consent, make a reel, and maybe after 10 visits, make another reel and see what is a change. So something like that you do. The patients, they really feel very connected with you. So the most important things are which are important in the tobacco cessation in we as a dental professionals is support to quit. You should give all your support. Then see, the fourth point, the supportive environment. Apart from the counseling, NRT, awareness, the most important point is supportive environment. You have to, even if initially the patients, they tell us that, Dr. Saab, I am not having any problem and I like it. Everyone in my family is using it. You don't have to, take a back bench. Keep on connecting with the patient the way they want, the way they are comfortable. But be connected till the time they are absolutely tobacco free. The legal framework which is there in our country, and yes, I've already started with this, is CODPA, right? So in the CODPA, I'll not go into the detail, but I'll just tell you that every year, 2 years, the different legislations they come. So as I told you that there are a lot of stakeholders which are involved. So just like that, we can't just, when the tobacco products are there and the government, that means it's not government is sitting quiet. But slowly and slowly, those legislations have to take into account. So sometimes the legislations can come as that there's a ban of the smoking in the public places. Sometimes it's the labels are there. So every year, the CODPA which comes, different legislations are being changed, and it is becoming, I'll not say more harsh, but yes, it is becoming, the legislations are becoming more evident. So initially the labels which were there in the tobacco product, the most common, Rajnigandha, if you have seen, uh, go back today and see the advertisement, always, even in the movies also, one line would be coming that this tobacco use is injurious, right? So like this, the legislations are there. So with this, I like to end. And yes, my take home message is dentists are not just minded, my dear students. We are not just clinicians. We are a way beyond, because we are connecting with so many people here and there, different specialist clinic, at community initiatives, schools, and in all, we are in touch with all kind of population. So we are not just clinicians, but we can be a real torch bearers to all tobacco control initiatives. Thank you.
Thank you so much, ma'am, for such an insightful and engaging session. Before we conclude, we would now like to open the floor for questions from the participants. Participants having questions may kindly type them in the chat box or may raise their hands. I will read them out for Dr. Swati Sharma, ma'am.
In the meanwhile, I think Principal Sir is here. So, sir, I would request you to kindly present the certificate to ma'am on our behalf. I'll just share my screen, sir.
Okay.
Just a minute, sir.
Once again, I'll express my gratitude to you, Dr. Swati, for sharing your views on this very hot topic on this particular platform. And on the behalf of entire team SDC, we all are thankful to you. Okay, and I echo your this last message that yes, as dentists, we people can be advocates of tobacco.
So thank you, sir. Thank you so much, sir. It was actually a privilege, and I'm so glad that you were there till the end of the lecture.
Yeah, I missed some of your presentation, but I thoroughly enjoyed. Okay.
Thank you so
And
much.
I hope all the delegates who were there throughout during this presentation, they must have gained and they must carry forward the message that has been given by Dr. Swati Sharma. Then only it will be beneficial to all of us. So thank you so much.
We have shared the certificate for ma'am, sir. If you could just present it to ma'am, sir.
Thank you so much.
Okay.
And one more certificate for a moderator for the day, Kushi Sharma, sir. If that could be presented to her, sir.
Thank you, Kushi. You did a wonderful job.
Yes.
Thank you, sir. Thank you
Yes,
so much, sir.
so impressed with your way of presentation, and you look so confident. Okay, God
Yes.
bless you and keep
Yes.
it up.
Thank you, sir. Thank you so much,
Very
sir.
nice. Very nice.
Thank you, sir. Are there any questions,
Okay,
Dr. Kushi?
okay.
No,
Thank you.
sir.
All the best. All the best for the future lectures also. Thank you.
Thank you.
Thank you, Dr.
Thank you,
Salim,
sir.
for inviting me.
Thank you, Principal, sir.
Any questions, Kushi, there?
No, sir. It appears all the queries have been addressed through the insightful discussion itself.
Now, taking ma'am's 5 more minutes, I'd like to ask ma'am a few questions. Ma'am, see, we have interns and final years here. So, ma'am, they know the experience in Himachal, but what is the experience out there in, Uttar Pradesh there, where you have a lot of competition as such, and how does tobacco cessation work? And do you have patients who come from other centers referred to you, your college, and how does experience work? Because here, we have a monopoly, as you can say. We deal with patients ourselves, so we don't have any competition as such. But what is your experience as there, and how do you deal with the relapse part of a patient, actually, ma'am?
Yeah, very well said, Dr. Sahil. Actually, a lot of challenges. I'll not say I like to correct you, not because a lot of competition, but I think in Uttar Pradesh as a state, the diversity of the population is huge, urban and peri-urban, and just a villager also, and the population size and the availability of the tobacco, that is a very big challenge. Because when we also go to the camps, and it's like, yes, people would be ready, but then how we deal is the question was this. So we try to take a follow-up, and we record it. As I said, we document it. We try to take a follow-up. There would be two sets of group of people. One who would be coming to us with the affected lesion, and yes, their quality of life would be deteriorated. One would be those who are not. So the best approach is we can document it, and then we have to do the follow-up. And among those, apart from the undergraduate usual posting, so among those who are interested, because those who are not interested, they would be interested once the interested one they show the results. So the interested students, a team could be made, and they can document, they can record it in the app itself, and they have to do the follow-ups. That is the main, I feel in a tobacco cessation, we have to do the follow-ups. That is, yes, and with evidence. Yes, we have to tell the patients that how it can be so dangerous.
All right. Thank you, ma'am. Another thing that we don't talk about when it comes to tobacco cessation as such, and I would like you to share with the students is, ma'am, the low success rate that we have, 0.5 to 2%. So we'll not talk about patients here. We'll talk about a public health dentist, not even a dentist. So how do you motivate your team when you are dejected, or you don't feel like doing tobacco cessation anymore because your patients will come back to you and with relapse, and you actually see one patient out of 90 in reality who have actually quit the habit successfully. So this becomes very demotivating, not only for the student, but for the teachers also, that what am I teaching and how am I able to implement it? So how do you motivate your students, and how should we encounter that in a clinical or community practice now?
Actually, I shared about this, I think, while I was giving the presentation also, that I'll not say 1 out of 10, I'll say maybe 1 out of 30 or 50 patients also. If we are able to control, then I'll say it's a hats off. And yes, because the public health dentists are also human beings ultimately. And apart from the tobacco cessations, we have a lot of things on our shoulders that what we have to accomplish when we go to the community settings. different kind of populations which we have to target. We can be having nursing mothers also. We can be having, a school child also. We can be having a youth also. So all of the expectations and different awareness. If we see tobacco, then I would say that, the kind of satisfaction which comes to us when the tobacco addiction, when even a single person is able to, I would say that that satisfaction is much more than getting demotivated. So this is how the USP of a public health dentist they go. And yes, we have to, it is a challenge, but then if we don't accept the challenge, what is the fun? So this is how it goes.
Very well said.
Yes, I must say, a wonderful child, and so nicely she addressed a very nice, nicely trained moderator, Dr. Sahil.
Thank you. Thank you so much, ma'am.
One last question, ma'am, for the students, because we've got you with us. How would you tell them about research in tobacco cessation and how they can pick up this topic for the future and provide data? And you've also done so much of research here. I think your paper on oral cancer registry has been very highly cited. So a lot of students, they have this mentality, tobacco is bahut purana ho gaya, so what research can we do? So how would you tell them that yes, this is still a topic that demands a lot of research, and you have a lot of scope in this topic,
Yes.
except for the 5 A's, 5 R's and 5 D's, or the few pages strong scale that we talk about?
I would say, actually, my dear students, what do you think that tobacco is an old topic? It's like every topic is an old, but that is what is required as a researcher to make that topic as a new. Not just making the topic as a new, but finding out what can be the new. So, in terms of the research, if we say, so different kind of methodologies, a qualitative research for a tobacco can be really a fruitful. And if we see from publication point of view also, it is something which is, I'll not say need of the hour, but it is quite accepted. It's a new norm now in a tobacco cessation. So qualitative research can be really very interesting also for the students, because the students are not exposed to qualitative research as an undergraduate, even as a postgraduate also. In India, the level of qualitative research is very less. So qualitative research, and that too on different populations, maybe a transgender or a sex workers, tobacco use in them with qualitative, it can be something, something very different. So this kind of a practice, students should not think about, just like a naive that, okay, tobacco hair, so it's all about just the 5 A's and 5 R's. Think about the newer research approach. No, why they have to think about the old school of thought? They should think about the qualitative part, or something like a mixed method in which they can use, they can take the data and then they can compare it with the qualitative. They can take the interviews, they can have a focus group discussions, compare that quantitative with the qualitative. They should do like that. So that they'll be published, they'll be happy also.
Well, I think if I would like to add for my own students that research needs aptitude, which needs your motivation. We are there for guidance. As such. So I think, Dr. Kushi, you could conclude the event if it is fine with you, ma'am.
Yes.
She'll just to give you a word of thanks. Dr. Kushi, if you could
I'm
just...
happy to see so many students. Yeah, I could not see all the students. That's a different thing. But at this hour, and I think a holiday is there tomorrow in your college as well. Then also, if they are there, I'm glad. But
actually, we did switch off the camera from as a moderator, ma'am, because then there's a lot of chaos in between. So we just put it on a hearing only mode to control the chaos.
So good that they are there at this point of time. Very nice. All the best.
Thank you, ma'am. Dr. Kushi, if you could just conclude the event.
Yes, sir. Thank you. As we come towards the end of today's webinar, I would like to sincerely thank Dr. Swati Sharma, ma'am, for delivering such an enlightening and impactful session. Your insights on public health, tobacco cessation, and preventive healthcare have provided us with valuable knowledge that will certainly help us grow as a future healthcare professional. I'm confident that every participant has gained a deeper understanding and meaningful perspective from today's discussion. On behalf of Himachal Dental College, I extend heartfelt gratitude to our esteemed speaker, our respected faculty members, organizing committee, and all participants for making this session successful. Events like these reflect our institution's commitment towards academic excellence, public health awareness, and empowering future healthcare professionals to contribute towards a tobacco-free and healthier society. Thank you everyone for joining us today. E-certificates will be provided to you all after the completion of this webinar series. The feedback form has been shared. Kindly fill it out and you may then leave the session. Have a pleasant evening ahead and stay healthy. Thank you.
Dr. Kushi, did we share the feedback form in the chat box?
Sir, I'll share it now.
Right. Thank you very much, ma'am, for your time and effort. And it was an honor and a privilege to have you here today, ma'am, especially as my guide and my mentor. It was really a very good, I'm really thankful to you, ma'am, for the same.
No, it's a privilege, and I'm very happy to see, they're all very lucky to have you as a public health dentist in that stage. I must say that. Yes.
You should see them during Viva times, then they'll tell you, ma'am. Or when they get the question paper during the terminals.
That's a part and parcel, right? So all the best. Yeah.
Thank you, ma'am.
Yeah. Bye-bye.
Thank you, ma'am.
Dear participants, please do fill this feedback form given to you. We have taken your attendance also, and when you finish all 3 lectures, we will share this e-certificate with you. Any questions that you have, please do let us know. This meeting has been recorded, so you will have the recordings on YouTube channel of the department for your reference whenever you want it. Any suggestions do you have, please do let us know. Thank you, Dr. Kushi, for a wonderful session. And thank you guys. I'm going to end the meeting for today. See you tomorrow at 6 p.m. All right. Thank you.
Thank you, sir.